Okay, I am here today with our friend Gloria, who started treatment in our office about the beginning of December. Gloria, first of all, tell me about your past history and being diagnosed with Hashimoto's. When were you diagnosed? How long have you been treating with other doctors with Hashimoto's? And just kind of give us your history.
Okay, well, I was feeling sick for a while. Let me think. I think it started actually in 1996, and I went to the endocrinologist, and they said I was fine. And then it started just kind of escalating more and more and more. And by 2005, I was really feeling bad, and I basically begged the doctors to do something because I was like exhausted all the time. I was sleeping and constantly, and just really was out of it. And my head was fuzzy, my thinking was fuzzy, everything was really fuzzy, and just like a dark cloud and that type of thing.
Gloria, how did that affect you socially? How did that affect your family life, work, all those different things? What kind of effect did that?
Well, it was a very gradual effect. It was a gradual negative effect, as I'm a very outgoing person, and I ended up getting more reclusive and started to diminish going out, and to the point where I didn't go out at all. So that was very different for me, and I didn't really interact with the neighbors anymore. Just talking with people that I normally talk with, it was too much. It was just, I knew it was taking away my energy and that type of thing. So I knew I couldn't interact with people, so because I just barely had enough energy for my kids and my husband. So
at that point, did you feel like you were just in this place where you were just kind of alone? Would that be a fair assessment?
Yeah.
You just wanted to be alone, maybe?
Yeah, just why I needed to be alone, because I didn't have the energy to bring anybody into my life to share anything with, because I barely had any for my family. Just talking with anybody else, and if they were kind of a needy person or needed something, that was just too much, and I just would shut down, like, oh, that's too much for me, and I can't handle it. So I just ended up not answering phones and that type of thing, and not talking to people. So yeah.
So let's fast forward back to last fall. That would be the fall of 2011, when you found our practice. How did that come about?
Oh gosh, how did that come? I was just feeling really bad constantly, and I was buying loads of vitamins, and I had realized through reading on the internet and that type of thing that had to do with my adrenal glands. So I was trying to address that myself. I was taking loads of adrenal, tablets of all sorts, and vitamins and pantothenic acid and those types of things, but nothing was really working. And or they would work a little bit, and then it was like gone, like maybe within the next 3 days. So then I knew something was going on more and more. It's just like, and I finally said, I can't do this on my own. I don't know what more I can do for myself, and I have a truckload of vitamins, and I can't take any more. I'm sick of this. So yeah, so then I decided I'm gonna look in the internet and see what I can find. So I just typed it in. I was thinking I was going to go to Chicago or somewhere like that, but I couldn't find anything in Chicago either. And so yeah, Dr. Hagmeyer's name popped up. Yeah. So
what was your experience like then when you started your program here?
Oh, well, it was good. I was really skeptical, though, to be honest. I just felt that I had no other choice, though. So I thought, okay, well. He seemed very confident and very assured about what he knew and that he could help me. So that's really what helped me. But I still kind of, to be honest, was a little skeptical because of all the vitamins I felt I was doing, the self-help books and all those types of things. So I really thought, yeah, I could do it myself. But then I realized I couldn't. And then he said he could. Yeah, I was just kind of like, okay, whatever, I'll try. And I followed everything that he said to the T, and I just really felt a big difference. Actually, right away, I'd say, okay, because I started, I think I bought
I think at the beginning of December, so it's been a little over 2 months that you've been.
Yeah, but I procrastinated with the tests, with the saliva test and all those. I kind of procrastinated.
So let's fast forward even maybe another 3-4 weeks from there.
Yeah.
End of December, beginning of January. is when we really started getting some test results back
Yeah.
for you. Is that correct?
Yeah,
Okay.
yes.
Okay.
Yeah.
And then when we were able to determine what was wrong with you and how to treat you, and we started doing some brain-based therapies here in the office, dietary changes, all those things that you do at home, what kind of changes did you then see?
Oh, I've seen a lot of positive changes. The amount of vitamins or supplements that he's prescribed were specific for different things that I had said that were wrong with me or that I felt was wrong. And that was one thing also I really liked. I liked that he didn't make me feel like I was crazy or making things up, so I liked that. And then the tests that he ran, you know, confirmed everything that I was saying to all these different doctors. And that's another thing, that the one doctor, and that was actually the deciding factor for me, is my endocrinologist was confident that I had a brain tumor or a tumor on my pituitary gland. And then I even had an MRI done, which was scary, you know, and so that's when I decided you had to come to Dr. Hagmeyer. So, but yeah, otherwise I've been having positive results. I'm having normal bowel movements now. They're darker colored though. I think it's the supplements doing that, I'm not sure, but have that, and I have sleeping. I'm sleeping much better, and it's like, you know, night and day. My body wants to go to sleep when it's supposed to. So I know, and and I just feel a lot more energetic. I've been taking the dog out for long walks again, and I'm actually talking. I talked on the phone, just called my sister, and talking all the way when coming over here. So yeah, a lot of good things. So yeah, I'm happy. So.
Lori, do you feel? Let's go back to the social part of it, because that was a big concern of yours back when you were feeling. You mentioned that when you weren't feeling well, you didn't want to be social. You didn't want to be talking to people.
Yeah.
Do you feel like that has changed?
Oh yeah, it's definitely changing. Yeah, because and it's before when I would talk on the phone, even if I wanted to talk, I would just lose the energy, and I knew I had to guide who I could talk with and what I could do, because I knew that I would crash out for the next few days. It was really bad, and I'd never met anybody as bad as me, you know. But I would crash out, and there was times where maybe we went to the store or something, or out to eat, and then I'd be like, oh, I gotta go home because I'm about to crash, and I knew, and I would be out for. And it wasn't sleep. It was definitely a crash, and I would definitely just like run to the bed, and I would just literally just fall in the bed and go out for 3, 4, 5 hours of sleeping or whatever that was, you know. So yeah. So now I walked the dog yesterday. I was up the whole night, and you know, in the evening I made dinners, nice hot meals, and I woke up early today, had my chili, and after I get done here, I'm going to go work out with my kids. So I'm really excited about that. So yeah.
Well, Gloria, and we can see the excitement. We'd love to see that. Let's just look forward a little bit. What are you looking forward to most now that you have experienced some of these
I don't
changes?
know. I'm just really. I can't. I know this is just the very beginning, and I'm already feeling really good. So I don't know. I can't believe I could be even more or better than this. But yeah.
Exciting future ahead, right?
Yeah. I'm just like, so yeah. I'm actually thinking about, because I'm figuring, well, by the middle of summer, I probably will be able to go on vacation, you know, and not worry if I'm going to crash out and work at being happy, you know, and that, because I had to kind of disguise that for the kids and that, and even though they're older, they knew I was disguising it, but they kind of wanted me to disguise it, but I did it for them and for everybody so we could all have a good time. But it was really hard. So this time I'm thinking, oh man, I think I'm going to be actually really, really enjoy it. Yeah.
Good. Well, Gloria, thank you. We thank you for your
Well,
story.
you're welcome.